As Harjot has introduced me, I have been in this advocacy field for about 11 years. I was just a clueless 16-year-old when I first entered into it, but my passion has kept me going. It's truly an honor to be attending here, but more than that, it's a privilege to speak and bring forward the perspectives of the youth. So, as I sit here, I can recall hundreds of times where the word fight has been said in many occasions, like today, which I believe speaks volumes because it is indeed a huge battle for the young advocates who have been fighting for. And with the experience of in the SRHR field for over a decade, I must acknowledge the significant fight for the autonomy, the call longing to reclaim our bodies and taking our own health into our very own hands. This has been long overdue. The challenge also has become enormous, so must our efforts to combat this issue as well. Next slide. So, because if you look at the bigger picture, almost a quarter of the population falling under the universal healthcare coverage are made up of the young people. And there is another significant group of children who will be the younger generation of tomorrow. Let alone that young people also account for half of the new cases, with numbers being above thousands globally on a daily basis. So this is how significant HIV self-care has become for the young people. Next. So today I'm not here just as a young person in the room, but also a provider. I'm a young medical doctor who recently graduated, and it takes me back to my ethics classes to this Venn diagram that you see, where all the principles of medical ethics are given equal importance. So why are we still facing the challenges in giving the autonomy to the young people when every aspect or when every element of medical ethics has an equal importance? As we resume our efforts to shift the narrative from pre-manufactured forms of passive care, which are narrated by some authorities at higher up with no voices of youth being included, to individualized young people centered care, we must acknowledge the importance of autonomy and also reclaiming our bodies in the process. Next. Now, let us take a glance on how the HIV prevention and care component is integrated into the UHC and how is it applicable for the youth. So first and foremost, the universality of care, which is a core principle of it, where integrated models are used in the access and it is expanded to the level of the primary health care. It must be ensured. And secondly, the mechanisms of delivery of care where other relevant stakeholders such as the youth-led organizations are involved. As we believe having that door open is a safe space for the youth, which will enable for us to move towards self-care with avenues that are more youth-friendly and also which will help the vulnerable and the marginalized young groups to be felt more welcomed to seek care with young hearts in mind. And on top of it, it also says it's important to have strategies tailored and ready for the catering of the key populations. And this is where young people fall into. And micro targeting the service coverage where young people are the center of the stage. Next. As we continue, we must also take this space to acknowledge while the legal young adults might have access in most of the areas across the globe, there remains a certain age group of young adolescents, particularly the ones who are below 18, where in some parts of the world they might require a parental consent to seek care. So while in some developed countries like the UK, the health system utilizes and applies principles of Fraser guidelines, also what is known as Gillick competency, which means simply a young person has the capacity to understand the gravity of the health issue and they understand the impacts of the treatment given. So as long as they're deemed to have this Gillick competency, I want to emphasize on point A and B, as you can see on the screen, where, for example, if somebody came to me, if I were a doctor in UK and if a young adolescent came to me to seek, for example, contraception services, So if I believe that person has the really competency to make the decision, I must provide it. So on this basis, why cannot the same principles be applied to the young adolescents seeking care for HIV and also empower them with self-care models instead of their age being a hindrance to access proper and timely care? Next, please. So, what do we want the whole health policy makers to ensure when they are deciding things for us? So, we demand for the young people to have proper right to information and confidentiality. With the right, especially self care being on the table, the right to information is so important. And when it comes to confidentiality, that also includes parents. If the patient does not want, or if the young person does not want the parent to know, we must respect that. And that would lead the young people to be equipped with the capacity to be the architects of our own health and well being. We also demand for expanded access to self care without having to justify before an authority or even having to jump through bureaucratic hoops, which are more massive than the virus that have gotten contracted with, and which in turn will motivate them to be the champions of their own bodies, because we do have easy access to care through self-care models. We also demand for youth-friendly providers. By youth-friendly providers, I mean providers who are free from stigma, taboo, and judgmental attitudes, which will make the young people more at ease to seek help. And again, this is again very applicable for to seek self-care. And we also demand for a seat at the decision-making table. And the young people no longer want to be accepting decisions made without the say and voice of the youth being heard. By giving a seat at the decision making table, we are also empowered with accountability both at policy level as well as at an individual level to be more accountable for our own health as well as self care. And as a young advocate, I also want to highlight the importance of having youth led advocacy movements. So, in my experience, advocacy movements without being youth led or without the involvement of the youth, it has only been an utter failure. So, we want more youth friendly approaches such as digitally profiled advocates. Popular among the youth being at the forefront of the advocacy, and digital health interventions being the core of the self care models developed for the youth, because nothing for the youth will be complete without the youth involved at all stages of care, and with the beacon of hope of having a more empowered and a more resilient